What is musical ear syndrome? Musical ear syndrome is when someone thinks they can hear music, but no one else can. Even though it may sound very real, often playing songs they recognize, it's all playing inside the head as a phantom sound. While these songs can't be heard by anyone else and pulled from memory such as childhood songs, MES is not a psychiatric disorder on its own. They're merely hallucinations and a more elaborate form of tinnitus, a complex auditory phantom perception. Musical ear syndrome versus earworms. Earworms are more like memories of tunes that you think about, rather than songs. Whereas, MES actually sounds like an unstoppable song is playing in your head. Signs and symptoms of MES. Hearing music when you know there's nothing around you. Songs can vary, but they're usually something from the past. The sound may seem to be in one ear. Tinnitus ringing is possible at the same time. The underlying problem. Just like the usual tinnitus ring, musical ear syndrome occurs when it's quiet, without a sound for the brain to process. The auditory cortex part of the brain, which is responsible for processing speech and music, has decided to create its own sound to fill the silence. Similar to Charles Bonnet syndrome, where the eyes see things that aren't really there, the ears are hearing things that don't exist. It could be due to vision loss if you're seeing things, whereas, you may be experiencing hearing loss if you're hearing things. Who gets MES and why? The main reason someone would suffer from MES is because of hearing loss. Just like tinnitus, the brain is having to work overtime due to loss of hearing, which results in a ringing from tinnitus or music from MES. This usually happens in later life, but it's possible to have an issue at any age. Other than hearing loss, other reasons could include a lot of stress, tiredness, or loneliness isolation over a long period of time. MES Diagnosis. Diagnosing musical ear syndrome begins with examining the patient's hearing history, before examining the current level of hearing. All other causes are ruled out before considering MES, such as psychiatric illness, neurological disease, or effects of medication. MES treatment. Since the issue is happening from hearing loss, wearing a hearing aid should significantly reduce, or even stop, symptoms of musical ear syndrome. Before hearing aids, the patient would need a hearing test. But there's no need to suffer while waiting. White noise, music or background noise of any kind, will help the brain to focus on something other than creating its own concert. MES is not a sign that dementia is coming, but the experience can still be stressful. Cognitive behavioral therapy (CBT) is also an option for dealing with symptoms, by teaching the necessary skills to manage stress. Next steps. If you or someone you know could be suffering from MES, the first step will be an appointment with an audiologist. You can book online, use our contact form, or call 01179 012526.